Vaccine distribution efforts in the U.S. are ramping up. President Biden has promised enough doses for all adults by the end of May. Part of the plan to reach that goal is to make the shots available at more than 20,000 pharmacies nationwide. But access to physical pharmacies is not an option for many people. That particularly includes those who live in rural areas. According to the Rural Policy Research Institute, 111 counties have zero pharmacies able to administer the vaccine. For more, I'm joined now by Dr. Michael Hogue. He's the Dean of the School of Pharmacy at Loma Linda University in California and the president of the American Pharmacists Association. Dr. Hogue, welcome. Thanks very much for being with us.
Thanks for having me.
So what are the short and long-term consequences of not having actual brick and mortar pharmacies available to roll out the vaccine? And could the pandemic last longer in some of these areas as a result?
Well, we have a situation in our country that I think many Americans are just unaware of, and that is that due to predatory pricing practices of pharmacy benefit management companies, reimbursing many times these small independent pharmacies less than they actually pay for the drugs that they're dispensing. These pharmacies don't have sustainable business, and what's happening is they're closing. And in many communities, the large chain box retail stores are not interested in coming into small towns in rural America, and that leaves these communities vulnerable with no access to health care. And so, yes, I mean, we need these pharmacies. And I think the pandemic tells us most acutely, gives us the best example of why we need these pharmacies, because these pharmacists can help stop this pandemic. They can administer these doses of vaccine and make sure that every American has access to the prevention service of vaccines.
Well, there are multiple reports of people who have to drive miles away from their home to get the vaccine, and that doesn't factor in if it's something they have to do twice if they receive the Moderna or Pfizer doses. So do you think this is something that is going to deter rural communities from getting the shot?
Well, I know that there are people in rural communities who really do want the vaccine, and they feel as though they might be overlooked and have a hard time getting access to the vaccine. We want to make sure that every person has equal access to the vaccine, regardless of where they live, regardless of their ethnicity or race. We want every individual to have equal access to vaccines. And community pharmacies are the best way to ensure that happens, because the pharmacist is a trusted information source in the community and is also able to get that vaccine to the right people who need it, who are most at risk of dying of coronavirus as quickly as possible. So it's really, really important that small pharmacies in rural communities quickly receive vaccine. And that's been a little bit of a challenge in a lot of states, just to be honest with you, because in a lot of states, all the vaccines gone to mass immunization centers where 4,000, 5,000, 6,000 people are getting vaccinated a day. That's wonderful in those urban areas where people can easily get to those centers. But in rural areas, people are disadvantaged and just don't have that chance. So we have to rely on these independent pharmacies. They're not going to administer 500 doses a day. They're going to administer 20, 30, 40, 50, 100 doses a day, but they're going to be consistent day after day after day after day. And just like the tortoise and the hare, sometimes the slow and steady wins the race, and we'll make sure that we end this pandemic quickly because they can be consistent in getting that in the arms of the people who need it.
So the Biden administration says it's committed to expanding mobile vaccination units into the nation's most underserved communities. Doctor, do you think that's enough to help address this vaccine disparity between urban and rural areas?
Well, there's no question that mobile vaccination clinics have a huge role to play in ending the pandemic. Here at Loma Linda University Health, we partner with community-based organizations, churches, other organizations to make sure that we can reach the communities that can't come to a mass vaccination clinic, such as the one that we operate here. So we're very active in ensuring that we reach into the community. We do have to be proactive and go to people to ensure that they can get this vaccine. People still have a lot of questions. The vaccine's safe and effective, and I know that, but there's a lot of people who have questions that need to be answered. And by using mobile clinics and going actively into communities where healthcare professionals, whether it's a nurse, a pharmacist, or a physician, can actively engage in conversation with people and get those questions answered and go ahead and vaccinate. So yes, mobile clinics have a tremendously important role to play, and I'm very much in support of expanding those mobile clinics along with this community pharmacy strategy. I think they go hand in hand.
It's such a critical issue to make sure that all Americans are in fact given that access to these vaccines. Dr. Michael Hogue, doctor, thanks very much for sharing your insights with us.
Thank you. Appreciate you having me.